So we're going to do some questions and answers. Some of you posted your questions, so I have them here. But if you have questions that you want to post, go ahead and just type them in. Hopefully I can catch them quickly as they're going by. It's a little bit difficult, but I'll try to answer some questions on the fly as well, and do as much as we can. So Laura, do you want to just introduce yourself a little bit? Give us your background. Tell everybody who you are. Say hi. And a lot of people already know you, but there's been so many new people. Did you guys notice we're about to hit 100,000 followers? So it's pretty exciting. There are moms all over the world that are joining this community. So we're excited to have new people all the time. So go ahead, Laura.
Yeah, so I'm Laura, for those of you that don't know me. I have three beautiful girls. My twins are 12 years old now, and my youngest is 7. And can't believe that it's been that long, but I breastfed the twins, and that was a rough road. Let me tell you, it's not easy to breastfeed, number one, and then it's certainly not easy to breastfeed twins. And I had so many people that would tell me, why are you doing that? Why not just give them formula? And obviously it was really important to me. So we got through a lot of the hurdles in the beginning, but I had a lot of back pain mostly during the postpartum and feeding stage. I had a lot of back pain during pregnancy, and that's the thing that everybody always talks about. But I noticed it even more so after I had them because, we know from my experience in teaching childbirth classes, during the pregnancy, we produce all of those hormones that loosen all the joints and ligaments throughout our bodies. And unfortunately, that doesn't go away overnight. Once you have the baby, everything is still loose, your abdominal muscles are compromised, and then you find yourself sitting and feeding for so many hours, and I just felt like I didn't have enough support, both physically and emotionally and mentally, the whole thing. So when I had my youngest daughter, and like I said, she's 7 now, I started having all of the same problems all over again. So I knew it wasn't just a twin thing. It wasn't just me. So many other people were having these issues too. And I decided at that time to finally do something about it. So my husband's a chiropractor. We couldn't find anything on the market that was supportive enough. And so I asked him to help me design it from a chiropractic standpoint. And then, I added all of these other little features to help mom. Because like you said, most of the products out there are there to support the baby, and there's really nothing to support the mom. And it's so, so important, in terms of having success when you're breastfeeding, to have the right position and for the mom to be comfortable. Because if you're not comfortable, your baby's not comfortable. And if you can't relax, it's really hard for your milk to let down, and it just makes things very, very difficult. So if there's anything that we can do to help that process, even if it's just by, having the right support behind your back, it makes a huge, huge difference.
Totally. And I loved what you said, because moms need support in all ways. And what you've created is like a way to really support moms, which is just put in a really practical and physical way. And that means so much, because when you're in pain, the product, and so let me just show it to you guys. This is the Back Buddy, and I know a lot of you have seen me sitting with it. I have one behind my back right now, and I can't tell you how much more comfortable. I'm literally sitting on a couch. This is like perfect. I'm sitting on a couch. I have the Back Buddy behind me. I have a nursing stool in front of me, because bending your knees higher than your hips, sitting with good support. Like right now, I'm in the perfect nursing position. All I need is a baby right now, and milk. I don't, that's been gone for a while. So I just need a baby right now, and I can feel myself completely, my body is completely relaxed with my knees up, my back sitting up. And so many of us are sitting on sofas, sinking in, sitting up in bed, up against the headboard, trying to stack the pillows and get ourselves just right. And it really is one of the keys to a good latch is good positioning. I mean, it's really hard to maintain a good latch when you don't have good positioning. So not only like what you said, as far as like being comfortable, having, dealing with your back pain, if your latch is not good, you're going to transfer less milk. And so it's one of those things that we talk about, which is, a secondary low milk supply issue, which could be caused by just not having the good support, and then impacting your latch. It's really, it's not just about comfort. It's also about milk supply. And I would say both. And it's like an indirect thing that a lot of people just don't realize it's what's causing it. And they're like,
Right.
why is my latch hurt? Why is my latch not good? Why is the baby on, and then not really be getting satisfied quickly? Why are the feedings taking so long? All those things could be just improper positioning of you. So we just had somebody join from South Africa. Welcome to the show. This is what I'm talking about. People from all over the world, and we all have the same common issues. Like when we're nursing a baby, there is no difference no matter where you are in the world. We're all dealing with the same thing. So I'm so happy to see you here. Megumi, welcome. Yeah, so that's something that I think is leads us into the questions right now. I want to just say too, we're going to be giving away a back buddy today. So if you want to enter to win, what you have to do is like or love this post, comment here at some point during the stream. Just tell me what you love about this product, why you need one, and how it would help you. And then make sure that you register by clicking on the link. Joe's going to put it up again here too. But just register on the link there so that you can win, and you'll get your choice of the back buddy. And we're also going to be giving away a discount code for everybody if you want to get one. But one more thing I want to say about that, we'll come back to more information about that. Let's do some questions. And then, where are you guys? Oh, Joe's asking questions. Where are you from? Look at everybody's California, Colorado, Ohio. Hi, Jessica. Hi, Anne. Hi, Conchita. Yay. Okay. All of our favorites are here today. Fantastic. Okay. So let's do a little bit of question and answer, and then we'll come back to some back buddy information. The first question came in from Krista. Okay, and she said, my daughter's almost 2 weeks old, and ever since she was born, she gets hiccups after every feeding. I burp her in the middle and after every feeding. Is this something I should be concerned about? She's also spitting up, but not that much, and she doesn't get fussy. So here's the deal with hiccups. Especially your baby's 2 weeks old, in a newborn phase, their digestive systems are immature, and those hiccups are just a normal part it's something normal that they get. They even start that in utero. How many people have felt your baby hiccuping while you're pregnant? Or maybe didn't realize that's what was happening, but now that you think about it, you're like, oh, that is what happened. Those little jumps, right, Laura? Have you had that? I remember that with both the girls. Yeah.
Yep.
So it's something that they do is they hiccup, and that's just the immaturity of their system. It truly is something. Yeah, you felt it. So it's something that really, we always say this, is it bothers you more than it bothers them. It looks like they're uncomfortable. It looks like you should be doing something about it, but really you don't need to. And it's not an indication of any problem. It's not an indication of reflux or anything else. It's just their bodies adjusting to actually taking food in. Think about it. They have, it's the beginning of eating. They come out and they're swallowing amniotic fluid, and then they're swallowing milk, and their bodies are getting used to the whole process of eating and swallowing and everything else. So hiccups are fine. Let's touch on the burping for a minute, because burping is important. And, I have a burping video that's pretty much gone viral at this point. We have 4 million views on the burping video. So I guess people really wanted to know about burping. If you haven't seen the burping video, then go back and watch the burping video. Just go to videos on my Facebook page, and you'll see it. It's up there on the top. But I teach people how to burp because there's a lot of like kind of that myth out there that breastfed babies don't need to burp, which they do. And anyone who swallows, when you're swallowing air. Even if you're breastfeeding nursing at the breast, you're still gulping, the baby's still gulping, they're swallowing air, and they do need to burp. And how often they need to burp really depends on the baby. Some babies need to burp more often, and if you have a very heavy letdown, or if you have a lot of milk, or it's like first thing in the morning when your milk supply may be higher, your baby may need to burp even more frequently. If you're seeing a lot of the baby spitting up a lot, it could be a lot of milk going in, but it could also be a lot of air going in, and that could cause the baby to spit up. So burp frequently. It shouldn't take long. With my burping method, you should be able to do that pretty quickly. Has anybody, let's ask the chat for a second. Have you guys been using the burping method? Love to hear your feedback if you've tried it. It's different than what you see. I don't do any padding, but it's really effective. Like it's just a really effective method, and the burps usually come out quickly. Um, and you want to do that frequently. Um, I think that as far as if your baby's spitting up a little bit but not fussy, I really wouldn't worry too much. We call those happy spitters. Some babies they just spit up, and a lot of it has to do with being able to, the baby's just gulping a lot and drinking a lot of milk, and their bodies are going to adjust. If they're overfed, very often they will spit up. The stomach can't stretch much more than what it is. And so usually you'll see this more with a bottle fed baby where they can be overfed, and you're kind of pouring the milk in unless you're watching the cues and doing paced feeding, which I always recommend. But even with breastfeeding, they could take in more than they need, and it's actually a healthy thing that they get rid of the extra, if it's there. So keeping your baby a little more upright, watching the baby while during the nursings, stopping and burping, and if you find that your baby's really like drowning in an oversupply where you have a lot of milk, a more upright position for nursing, or even a laid back position where the baby's more on top of you than underneath you, will also help for them to be able to control the feeding a little more. So that laid back position is really, really helpful. I just had a mom I did a telephone consultation with, and she had just come home from the hospital. She was trying, different methods, cross cradle, all kinds of methods, and just really not getting, it just wasn't working for her. And she was so exhausted. And so finally I just said, lay back on your couch, like put some pillows and lay down, in an upright position, but laying back, and then just lay the baby on top of you and see what happens. And she was on the video call, and the baby just went and latched right on. And it's one of those things too where that's more of a natural, actually that supine position where they're actually touching their belly to yours, and they're able to like almost continue that breast crawl positioning. All of those things actually trigger the baby's natural instincts and reflexes to latch themselves. Would you say that, Laura? Did you try some of that?
I absolutely, I used to do that a lot with the laid back breastfeeding. But like you said, babies do have that natural instinct to find the breast and to latch on themselves. And maybe if they're not, being forced into it, or if they're not, on their back and being smothered, they often do better when they latch on their own.
Yeah,
But it
absolutely.
depends on the baby and the situation. But
Yeah, totally. I mean, there's not like one position that works for everyone. Two of my favorite positions, well, there's three. The one is the cross cradle position. I talk about this in my Simply Breastfeeding class. It's just a really good position for a newborn because it helps to support the baby's head, where the baby really needs, if you're not using gravity, like a laid back position, the baby has a hard time holding their head to your breast. And so many times I'll see new moms, they're holding the baby and the baby just keeps turning their head away because they don't know where to look. They just know how to suck. It's like you need to put the nipple towards their mouth so that they can stay latched on. Cross cradle allows you to help hold the baby in position. But when you do the laid back, gravity's working for you so that you can really get that deep latch.
right.
And then as the baby gets older, my absolute favorite position is the lying down position because you can lie down and you can rest while your baby's latching on. Yeah. What's your favorite position for feeding? Any of our nursing moms out there, go ahead and post right now. What's your favorite position for feeding? Cross cradle, laid back, lying down, football. I mean, there's many positions to feed in. Upside down. I just posted a picture of that of my mom. Oh, and also I had a picture recently. Did you see the twin mom on my page that she had both her babies laying down on the bed and she was just leaning over and letting the breast go down into, and I was like, oh, she's working her core, and honestly it's helping that milk let down with gravity. So it was pretty cool. Pretty cool.
In my experience with the twins, I did a lot of the getting up during the middle of the night and everything on my own because my husband works so much. And I'll tell you what, the lying down while I was breastfeeding literally saved me because I remember being up so much, and I tried at one point to, other people suggested that when one wakes up, to wake up the other one and feed them both at the same time. But it just didn't really work that well for me. I tried it a couple of times, and then I'd have one fussy baby, and then one baby who just woke up and didn't want to be woken up, and then it was just nuts for me. So I used to always feed them individually, and I kind of felt like it was better one-on-one time with each of them, and I could kind of figure out their style and how they nursed, and they were very, very different too. So when I finally figured out, that we could lie down and nurse, that like saved my life because I
Yeah.
was literally up all night. And I remember just, one would wake up and I would feed her. I would take her out of her crib. I had a mattress in the baby's room on the floor, and I would lay down on the floor with her and I would feed her and I would rest kind of like half asleep. And then when the other one would wake up, I would put her back in her bed and I would bring the other one to me, and it was just kind of back and forth. But honestly, that saved me. Once I figured out how to do that, it was the only way I could get any rest.
It's one of the best things to do. It's just sometimes, and so if you're out there and you're like, I'm trying this laying down, but it's not working with my newborn, it's not always an easy position with a newborn because they're
I
so
know.
small. They kind of slip underneath, they can't really hold the latch. And so, if you're not able to do it for the first few weeks, don't stress because it's coming. And as they get to be a little bit bigger, a little bit more advanced in their ability to latch themselves,
Right.
you're going to be able to do that position. I'm reading here. Mickey just posted here a question. She said her son is 20 days old, feeding on demand, been using a nipple shield, but was taking too much air. Now uses my nipple, but it hurts a lot when he starts off. Been using the football method. Any tips? Definitely going to try that. Okay, so just a quick thing about that football position, and it's I know for some people they're like, I love the football position. From my experience working with thousands of moms and the football position, what I find is that you may have the nipple pain because um, when the baby comes to the breast in the football position, they literally bring their head into this position here. Think about it. You bring the baby up and the head, the neck is angling this way. That causes the baby to lead with their upper palate, like their upper jaw versus the lower jaw. When you watch like my Simply Breastfeeding class, and there's a whole chapter on how to latch and create good positioning to know what to look for. I'm always talking about the head extending upward like this and coming to the breast this way. A couple of things happen when you bring the baby to the breast with the head in this position is that one, they're leading with their lower jaw and their tongue. Okay, so more of the areola is going to be in the baby's mouth from the bottom than at the top. It's going to be asymmetrical. So the baby's coming this way to the breast, and their tongue and their lower jaw are leading, versus the hard palate that can rub against the nipple. Okay, and the tongue is really what's creating that negative vacuum that causes the milk to express as well. So that tongue is important. The other thing too is when the baby's with their. Am I echoing? I don't know. If
You're
I'm
okay.
echoing, let me know. The other thing that happens when the baby's leading with their upper jaw and their head is tilted is that they can't, their nose is really smushed into your breast. And you want to be able to pull them as close as possible to get the nipple as far back in their mouth as you can. To do that, you have to hold the baby really close. If the head is like this, then the nose is really smushed and it makes it difficult for them to breathe. If you do it like this, you can really push them in closer, and their nose is still not occluded. They can still breathe through their nostrils, and babies are born with really flat noses for that purpose of being able to really pull into the breast and still be able to breathe and suck and swallow. That's a skill that they're born with. Okay, so bring them in this way and they can still breathe. And then the last thing, everybody at home, I want you to do this with me right now. Okay, just put your head down like this. Okay, so put your head down, and then when you're down like this, swallow. Try to swallow, okay? So the more the baby's head is in this position, it's just physics, okay? They're not going to be able to swallow when their head is down like this, but when their head is up like that, the milk will transfer better down their throat. It'll make the feedings more efficient. It'll make the feedings more comfortable for the baby and quicker. And so all three of those things are keys to successful latch and positioning that I go over in the program. And football holds can be a problem with that. Now, if you're feeding twins, like Laura was talking about, football hold may be an ideal position, but maybe when they get a little bit bigger. And
Right.
like you said, you fed them both separately. I'm going to be doing a whole class coming up on feeding two, meaning tandem feeding, feeding during pregnancy, and feeding multiples. It's our next module that we're going to be filming. So if you want to be a part of that, I'm going to be filming them live. So make sure that you're signed up to get my notifications, and then that's going to be our next course. But it's something that I do recommend. Everybody has their own opinions about how to feed twins, but as a lactation consultant and someone who has worked with, I've delivered a lot of twins in my practice, and I've also worked with a lot of twins for nursing. Find that it's sort of an advanced skill to tandem nurse them right from the first day. Some people can do it, others can't, and usually the feedings even go quicker if you separate them.
Yeah,
So,
I found they were able to feed better that way. But again, it depends on the situation. Some people can do that and some people can't. I found that when they were really little, they were they needed more support. They were so wobbly. It was really hard to feed them both at the same time because they needed more assistance to get in the right position. Then when they were a little bit bigger, then they would just kick each other or push each other, and then that
right.
became difficult for me. So that's what worked for me, but I know that a lot of people do feed twins at the same time, and they've had a lot of success with that too. So I think every situation is
I always recommend eventually getting to that. But, in the beginning, you want to make sure that you're paying attention to who's swallowing, that you have the right latch. You don't want to get sore. You want to transfer the milk. Newborn babies are slow feeders to begin with usually. And you're engorged, which makes the nipple flatter, can make it more difficult to get a good latch. And you're really needing to pay attention. It's not just hanging the baby off the nipple. That comes later. You put them there, they latch, they're good. So if you're nursing two at the same time, that may be the reason that you're feeling any kind of that. There's too many good questions coming in here. I'm going to keep going with who's here live with us. Okay. So let me just answer another question here. Abigail said, I just found out that my baby has a lip tie. Two doctors we have seen don't want to fix it. What are some ways that I can fix her latch to reduce my pain while breastfeeding? Okay. So here's what I want to say about lip and tongue ties. It is highly, highly unusual for a baby or anyone to have a lip tie without having also a tongue tie. They go hand in hand. So, you may see the lip tie, the tongue tie may not be as obvious in the case of a posterior tongue tie, but both are probably present, and it is important to fix it. If you are, I would say that if you're struggling with the latch, if you're asking me the question of like, how do I fix her latch, then you're having the effects of that issue right now. Even if you weren't having the effects, and we hear that all the time, I see the lip tie, I see the tongue tie, but my milk supply is fine and I'm not having any pain. Is there a problem? Do I really need to fix it? Yes, there's still an issue because breastfeeding is only the first time you're going to notice the issue. It's the first time we will see that there's a problem with this tongue or lip tie. It's a little controversial, this whole tongue and lip tie, but from all that I've learned over the last few months and year of working with some of the top experts in this field, I understand that it's not just about breastfeeding. This is about long-term issues that the child can have when it comes to speech, when it comes to feeding later. And feeding a bottle doesn't fix the issue. They'll still have issues. Many children with lip and tongue ties will also experience reflux from all the air that they're swallowing, from not being able to keep the seal. We call that aerophagia. And they wind up with medications for reflux. They can have weight gain issues. And even in the beginning, when you're not seeing necessarily a milk supply problem from it, it can eventually turn into a milk supply issue. So you may not notice it right away, but then as time goes on, the milk supply issue can catch up with you, and you just want to avoid it. You want to really avoid it. So a lot of the pediatricians and a lot of the doctors that are looking at the baby may not be as knowledgeable about tongue and lip ties, and are telling you not to correct the issue. You need to go to someone who really knows what they're talking about. As far as helping to reduce the latch, if it is that, it's going to be really hard to do because the baby just can't, the tongue is not functional. The baby needs those oral structures to really be working properly to get the right latch. And if anything's restricted, if that tongue is restricted, it's going to be really hard to get a good latch. I would say holding the baby closer is going to help, like we just talked about, tilting the head, making sure that you're optimizing, the way that you're latching is going to help, but really you need to get it fixed. We have an amazing show coming up. We did one over the summer, right before the summer, with Dr. Scott Siegel about tongue and lip ties, which was really great. It's now part of our video library. So we have a membership coming up. We're about to launch this month. We're going to be launching our membership site, which is very exciting. It'll include our entire library of all of our live streams, all of our Q&As. Everything's going to be time coded and able to see what you need. There's over 800 videos, plus a private Facebook group and live Q&As with me every week, so you can work more closely with me. So make sure you're on the list and you're getting the updates, because I'm really excited about the launch that's coming. It'll also include all of my classes too. It's like a full education, and really to be able to work with me closer than just here on our full page. But we're going to be doing that episode is there in the library now, and we're also going to be doing a summit coming up in October, all about tongue and lip ties. And I'm going to get back to you with the date. I believe it's right at the end of October. We have 5 top experts in all different disciplines coming on to talk about tongue and lip ties in a much more thorough way, so that you can learn everything you need to learn. And it is more prevalent right now, and they'll explain why. There is a reason why we're seeing it. So Abigail, find another practitioner who knows what they're talking about and get the baby reevaluated. It's a pretty simple procedure, and it's necessary. Jennifer saying her baby had a tongue and lip tie, was revised, and has gotten so much better since it was done along with feeding therapy. Yes, and that's a good point. It's not just about the revision, it's about the therapy that follows. Yeah, fantastic. All right, awesome. Good questions. What? Hearts. Yeah, let's give hearts. Let's give hearts to Abigail. That was a good question. We always like to give a lot of love here in our streams and to our community. You guys are such amazing moms and dads. We have dads here too, but we always want to give a lot of support and love. Like Laura said earlier, the one thing we need as moms is lots of support. What's a better way to get support than be here? We're all going through it. So yeah, lots of love. Thank you guys. I see all your hearts, and the hearts make me happy too. I love to see them. We have a question here. I don't know if I'm saying the name right. It's Adora Muste. Okay. I had problems nursing my daughter because I felt like I wasn't producing enough milk. She wasn't adding weight and no wet diapers. Any tips on how to produce more? Because here in Nigeria, I've not been able to breastfeed. Not being able to breastfeed is a sign of failure. Okay, perfect example of, like, here we are all over the world. This is this is a mama from Africa, Nigeria, and she's dealing with some of the same things that you guys are dealing with, which is low milk supply. And so, there's so many reasons why a mother could have low milk supply. Recently, I did my class on low milk supply. It was one of the first modules that we filmed as we started to create the breastfeeding challenges series that we're working on right now. It is available. Joe can go ahead and post a link to the low milk supply course. Basically, what I'm talking about there, and what I'm going to say to her here, is that there's many reasons why you can have a low milk supply. There's what we consider primary reasons and secondary reasons. Primary reasons would be real medical conditions like hormonal issues, somebody with POS, somebody with thyroid issues. It could be a physical issue where it's a tongue tie or a lip tie with the baby that causes that low milk supply, like we just discussed. It can also be insufficient glandular tissue where you're born with less mammary tissue to produce milk. These are all primary medical issues. It doesn't mean that they can't be helped. You can't find ways to correct that, or at least be able to breastfeed some, even if not all, even if not exclusive. But then there's the secondary issues, and the secondary low milk. So these are real milk supply issues. And I'm going to say this again because it's like there's two kinds of milk supply issues. There's the perceived, and then there's the real. Okay, perceived is like, I think I make less milk, but it's actually a normal amount, which is just not having the knowledge of what is actually normal for a breastfed baby. But when we talk about real, that's where the primary and the secondary issues come in. And when we talk about a secondary issue, it means that you weren't born with a condition that causes low milk supply. It's not a medical issue. It's something that you did during the process, starting from the first day or even later, that is causing your supply to be low. And it doesn't mean that, I don't mean that you did it intentionally. I mean that you didn't know that something you were doing was actually causing your supply issue. It could be early supplementation when it wasn't necessary. Sometimes it is necessary, but most of the time it's not. And so that could cause a low supply. Improper latch and position. You're not sitting with a back buddy and you're not getting good position. Your baby's not latching right to the breast. That could cause a low milk supply. So when we talk about tips on how to produce more, it's hard to give you one real answer. I would say if the only answer if I had to answer it in one way, it would be breastfeed more. The number one thing that's going to help you to increase your supply is more feeding. You could take all the supplements in the world. You could drink all the tea in the world. You could do all of these things, but if you're not draining the breast frequently and often, and you're allowing the breast to stay full or engorge, that's sending huge signals to your brain to make less milk. Your body is dependent on it's a supply and demand system. And so when you nurse less, you make less. Okay, when you nurse more, you make more. So don't allow your breasts to get too full. Okay, like if your breasts are really, it's like that. It's like a counterintuitive. You're doing the opposite of what you need to do. You know what I'm talking about, Laura? Like you wait. You're like, okay, should I pump now? Should I feed now? You kind of feel your breast. You're like, oh, I don't feel that full. I'll wait till I feel a little bit fuller, then I'll feed or pump. It's not what you want to do. That's actually going to decrease your supply.
Right. The supply will meet the demand. So the more you feed, the more you're sending signals to your brain that you need to produce more. Like you said, if you're not emptying the breast, your body thinks that it doesn't need to produce anymore. And that's hard for a lot of people to understand. And when I had my twins, I was advised by the people in the hospital to supplement. They thought that that's what twin moms needed to do, I guess. And I didn't know any better. And so I did start feeding them formula in the hospital while I was nursing, and I struggled for a couple of weeks, like really, really struggled. And as time went on and I started to learn more, and as I became certified to teach classes and I learned breastfeeding and how to teach breastfeeding, I realized that I was doing it all wrong. I should have never listened to them, telling me to supplement. I should have just right off the bat fed on demand, because then the more I fed, the more I would have produced. And once I figured that out, after a couple of weeks, I was able to breastfeed exclusively, but it was really, really hard to get over that hump. And I do feel like I should have, from the very beginning, just fed as often as I possibly could.
Yep. Early on, again, in my course, I talk about, short, frequent feedings. The feedings don't need to be prolonged, and even the prolonged feedings can make you very tired. It can make you very sore. But if you're latching them properly, you're nursing for short periods until your milk comes in, those first few days in the hospital or after the baby's birth, but doing it frequently is going to give the baby all the colostrum that they need. It's also going to help to build those receptor sites, those important receptor sites for prolactin in the breast, so that you establish a good milk supply long term. But being able to uh, going long periods because you may have visitors in the room or the baby's sleepy and you're not doing skin to skin. Skin to skin is the best way to get your baby to kind of wake up and want to nurse. It again, it kicks in all those natural instincts in the baby. But really trying to nurse frequently and keep that once the milk comes in, to really make sure you're watching the baby for the feeding cues, watching the baby. Don't put off the feedings. Don't try to use a pacifier instead. And really don't question yourself as long as the baby has those wet and poop diapers that we talk about. You can't measure what's going in. With breastfeeding, it's just
like you're not producing very much and you think, oh, the baby's not getting anything, but you might actually be producing more than you think. And especially like you said with the colostrum in those first couple days, it doesn't feel like a lot is coming out, but that is so important and they need that. And it is, I mean, really, when babies are born, I learned from teaching classes, they used to tell us that babies really have built-in nutrition for about 3 days.
yeah.
So as long as your milk comes in within 3 days, and it may take 3 days, that's okay. The baby will be fine. Just keep feeding on demand and it will come in eventually. But it's scary at first. You sometimes feel like, oh my gosh, the baby's not getting enough.
Mm-hmm. And it's true, you think this is not something that was designed by man. Okay, this was designed by something way bigger than us. The way
Right.
the whole body works, the way that our milk takes several days to come in, the whole mechanism of it, the physiology of it. It's not just you that doesn't have milk those first few days, it's everyone. And you always have to wonder when something is just that way, there's a reason. Nature wouldn't have it that you would grow this beautiful baby, you would deliver, you would be able to create this human, and then they come out and you just don't make enough food to feed them. It doesn't work that way. And so something is really important to pay attention to, is that this is the way the body works. That being said, there's all kinds of deviations from that. We're watching the baby to make sure the baby's healthy and everything's okay. But really educate yourself so that you're not just at the mercy of every single person who talks to you and says, oh, baby's crying, baby's not eating enough, the baby's hungry or starving. Not necessarily true. And most of the cases not. So
So
let's
easy to doubt yourself in the beginning.
yeah, definitely, definitely. Before we move on to the next question, I just wanted to make sure that Joe posted the link for Laura's website and to be able to get the Back Buddy. Talk about one more thing with the Back Buddy. There's not only is it physically great and supportive for moms and babies, but there's also another feature to the Back Buddy that I always like to talk about because it's something that many don't think about, but it's important, and that's the quality of what this product is made of and the foam that's in here.
Yeah, and that's something that maybe not everybody thinks about in the beginning when you're buying things for your baby, and we sometimes just assume that if it's on the store shelf, it's safe or it's fine. But one of the things that was really, really important to me was the quality of the foam. And our foam is actually certified by a company called CertiPure US. And if you go to their website too, they list all of the manufacturers that have certified foam. And what they certify is that the foam is made without any PBDE flame retardants, no CFCs, no phthalates, no formaldehyde, no mercury, lead, or other heavy metals. Basically, that it doesn't have any harmful emissions. So you think about like the mattress that you sleep on and other products that have foam in them, and you have to really be careful about the off-gassing of these chemicals because they really do have long-term effects on your health. So this was something when we made this, it was very important to me to make sure that we had foam that was safe, that was clean, that we don't have to worry about new moms and babies being around it so much because I spent hours and hours feeding and how much time are you going to be sitting in this thing? You want to make sure, obviously, that
Yeah.
you're not breathing in any toxic fumes.
Totally, totally.
Yeah.
It's one of the most important things, things that you can't wash, things that are going to be near you that you're, like you said, have these chemicals that do off gas. They do, the baby is breathing these things in. We just had a show this week with Lullaby Earth, and it's the same thing. It's the mattresses, and to make sure that they're sleeping on a safe mattress. Same thing with these pillows, and there are other pillows out there, and they don't have the safe foam. So it's like something you can't see, but it's seeing you. It's affecting you. And so always want to be as safe as possible with your baby. And it's, you know what, it's baby safety month. And safety is not just about physical safety. Safety is about health. And
Right.
and so I think that fits in perfectly with baby safety month too.
We do so many things. We try to keep our babies safe, and we try to keep them healthy, and we try to feed them good foods. And you don't think about sometimes some of those other things that they're exposed to that could really be very dangerous. So that
Totally.
was one of my top priorities when we were manufacturing this, was to make sure that it was clean, safe foam.
Totally. Let's get some hearts going across the screen for the back buddy. And if you want to win a back buddy today, you just have to like this post, comment here, tell me what you love about it, why you need it, how it will change your life. And you can also put in, if you want to, which colors you like the best too. We'd like to hear like which patterns and colors. They come in all different prints and solids, and they're so soft. I find myself petting them all the time. Like I just want to touch it because the fabric is that really soft, like minky type of fabric that I just love, and I just keep touching it. So that's why I'm sitting here stroking the back buddy today. But it's so comfortable. And yes, Pat, it's very, very supportive. Great hearts. And then also make sure you register with the link in the post here, because that's what's going to make you eligible to win the prize. We have one more question here. The question was, no, actually I have two more questions I'm going to answer. One came from Conchita, and I know she's here. Hi, Conchita. The question is, I will be having my wisdom teeth pulled out soon. I'll be under general anesthesia. I don't wake well. I don't do well awake, LOL, she said. Can I still breastfeed after they're pulled out, or will the anesthesia harm my son who's 3 months old? Such a good question. It comes up all the time. I get private messages, emergency messages. I'm having my gallbladder out, and what do I do? And they're telling me I have to pump and dump my milk. Okay. So let's just get this very clear. General anesthesia obviously is unsafe to breastfeed with when you're asleep. So while you're out unconscious, yes, you will not be nursing your baby, obviously. Once you wake up, what that means is that medication has quickly come out of your body. The medication clears from your body quickly. It is totally safe. The moment that you're stable enough, awake enough to hold your baby and nurse, it's safe at that point to go ahead and breastfeed. So there is no time that you need to wait. There is no time that you need to pump and dump the milk. Okay, there is nothing about it that will actually harm the baby. And beyond just the fact that most medications are safe to take and breastfeed, because such a small percentage actually goes into the milk, if at all. Specifically, when we talk about medications that are inhaled or given through IV routes, like injectables, here's what I want to say about that. And you could say this to your physician, because when you explain it this way, they're going to say, oh, yeah. If you were to drink the medication that they gave you through the IV, it would not affect you. Okay? That medication is meant to go IV or inhaled. That's how it works. It's the route of administration. Okay? It would get stopped in the GI tract. So even if that medication they're giving you an IV, they're having you breathe something that puts you out for general anesthesia. Remember, if it goes into your milk, the route of administration to the baby is not through the IV. They're drinking it, okay? If they're drinking it at all, even if it even crosses. it's not going to work the same way. It's not going to impact the baby. So I hope that makes sense to you, because a lot of times doctors, nurses, anesthesiologists are not thinking this through properly. Okay. And they're not looking at the actual medication saying, this has a really short half-life. That's the point. This comes in and out of the system quickly. That's the point. We want you to wake up. When you wake up, it's coming out. When medication does go through into the breast milk, it is usually at like a small percentage of what you're taking. And that being said, it also comes out of the milk. All right. So it's not like once it goes in, that milk is ruined. Given a little bit of time, just the way it transferred in, it transfers back out, goes back into the bloodstream, and gets filtered out by the liver and the kidneys. Okay. So yes, when you wake up, it is safe to nurse your baby. What's unsafe is to not nurse your baby at that point and wind up with engorgement, plugged ducts, mastitis, and then probably a decreased supply because you waited too long to feed, or you're trying to pump and throw the milk out, or giving your baby formula, which is not what you want to do at that point if you're breastfeeding. So I hope that makes sense, especially on medic. So who was asking me? I had somebody message me the other day about needing local anesthetic for getting a tooth pulled. Okay, same thing. That local anesthetic is not going to transfer into your milk where the baby can actually swallow it and have some impact from it. All right. So good question, Conchita. Good luck with your surgery. And as soon as you're awake, tell them to bring that baby over to you so that you can breastfeed. Okay. Let's get some hearts. They're giving us the colors they love. Yeah. So Conchita said that she asked the dentist and she didn't know what to say. Yeah, that's usually the problem. That's why you have to be knowledgeable yourself. And that's why, that's why I do what I do here. Otherwise, the other alternative is to start Googling. And, Google's great for certain things, but you want to really make sure that the person that you're taking advice from is a real practitioner, is somebody with a real medical degree, someone who's done this for years and years and years. I've been practicing for over 27 years. So for those of you guys who are new, who don't know that, I didn't just show up on Facebook one day. Okay. Yes, I'm a mom. Yes, I'm a breastfeeding mom. But the advice I'm giving you is from years and years of experience as a nurse, as a certified nurse midwife. I delivered babies for a long, long time. That was my career up until 10 years ago when I became an international board certified lactation consultant. I have a private practice here in New Jersey. I work with moms and I have worked with moms. And so you really want to make sure that the advice you're getting is from someone who really works in this field and knows the answer. And that's what I love about our community and being able to do this on live streams and do these, even the membership group, our online classes, is that I can work with you and I can support you to have that knowledge. So you can take it back to your practitioner, to your doctor, to your dentist, to your friends and family, and really have that information that will empower you to get what you want, to know the truth about things, and to research. And that's what's going to be great about our membership too, is that as you have these questions come up, I can work with you more personally and we can all be a part of a group there. So anybody interested in the membership, anybody thinking that's what they're going to probably do, because if you want to make sure that you will come in here, I would love for you guys to join me there. We're going to have a great experience, and make sure you get on the mailing list so that you're the first to hear when it finally launches. I'll probably have some specials on the initial launch. So I want to go over one more question, and this came in from Rebecca Grace. And Rebecca said, I'm 4 weeks from D-Day, delivery day, and I'm packing my hospital bag. Any tips on what I should bring with me to help me breastfeed my little one? Such a good question. And I love that you're thinking ahead and you're saying, okay, what do I need? What do I need to know? What do I need to bring? What do I need to have so that I can start from the first day? Too many moms, I'm sure you know this too, Laura, from teaching childbirth classes, they're so focused on the birth. It's like, just get me through the delivery and then I'll deal with that after. But you can't do that. With breastfeeding, you really don't want to wing it.
No, you have to prepare. And that's really, really good that she's thinking ahead like that. That was one of the things that I used to always tell people. I'm like, you see the birth as being like the end point, but it's not. It's the beginning. And so you have to think about, especially those first few weeks after, And having a resource like you, like having Shari available to answer your questions and to learn all these things, it is so, so valuable. And I don't even think people realize until that time how important that is to have somebody to as a resource to reach out to if they need help.
Totally.
Yeah.
Totally. Well, that's what I love so much about doing this is like I would never like Adora Mosti here, who's in Africa, who just so happy that she's here in a live stream with us. When would we ever have the opportunity to be able to support people all over the world? And the information is really the same. And so it doesn't matter where you're from, what your culture is, what your religion is, where your background is, where are you awake when we're sleeping? Are we asleep when you're awake? It doesn't matter. And all of that we're going to be providing is available 24 hours a day. So it doesn't matter where you are in the world. We want you part of the community so that you can learn along with us and offer too. And that's the best thing about the community is that it's not just about me answering your questions. Yes, I'll be there, but it's also about helping each other. Moms who are all like-minded and dads who are like-minded to be able to help each other and offer advice. So that's what we'll be doing. So back to Rebecca Grace's question about what does she need to do to prepare. There's not much that you need to take with you. I would say if I had to think of some of the products that I would have on hand, Back Buddy would be one of them because the hospital beds are pretty uncomfortable and having something supportive. So if you're going to get yourself a Back Buddy, start from the beginning, bring it to the hospital, help you to sit up in bed. It'll help you to sit in the chair and have more support. Again, with a newborn, it's extremely important to be positioning right from the first day. So Back Buddy, of course, I'm not just saying that because Laura's sitting here watching this Huffington. I really mean that. I mean, the products that I recommend and that the brands that I work with, it's because I truly believe in what they're selling and what they've made.
And we
But then that
mind, the hospital beds were one of the things that we had in mind because there's no support in the hospital beds. So even though you can prop up a bunch of pillows behind you, it really doesn't give you the support that you need. So that was something that we had thought about prior to designing this. And this was meant to be long term. It's something that you can use in the hospital. You can use it at home during your pregnancy. You can use it at home after. And then obviously, Shari and I don't have babies anymore, and we still use them for working on the computer or watching
on my couch, and we all use them, the whole family, for everything. But the other things I would recommend is having some really good, comfortable, stretchy bras, nursing bras. Bras that you can wear even during, Rumina bras that we always recommend. We work with Rumina. They're amazing. They have a great line of bras that are perfect for taking with you to the hospital, even wearing in labor. You can pump in them, you can nurse in them. But in the beginning, especially because they're full exposure, you want to be able to open it completely and be able to do skin to skin with the baby. And you're going to need that support and also to be wearing your nursing pads as well. So those are amazing. I would definitely do that. If you have a nursing pillow that you love, something really supportive that's going to help you position the baby up at the breast. I like a nursing pillow. Some lactation consultants recommend using regular pillows. For me, I like a really supportive nursing pillow. And then, the main thing after those few things that you need is really take my Simply Breastfeeding class. And I'm not just saying that because it's my class. I'm saying that to offer you the best support I can. Literally, it is what you need to know before you get to the hospital. It is everything right there in 10 chapters that you can watch very easily from home to prepare yourself mentally with your commitment and your confidence. I mean, I talk about this in the class that, the information on how to latch, or what we talked about even earlier, that simple thing of knowing how the baby's head needs to be looking. That's just so important. That one thing is just one of many things that I go over. But that's just one part, is the physicalness of how to latch a baby. That's 5% of what you'll get out of this class. The 95%, the most important thing that you'll get out of it is that confidence confidence and the commitment, because that's what's going to get you through. And when I used to talk to my live students in my live classes, and I would say to them, that's the best thing I can give you, is that confidence, and help you with the commitment to stick with it. They didn't understand it till after. And then I would get moms come back. I never forget the one mom came back to me and she said, I don't know if you remember me. I was here a few years ago with my first baby. I took your class and I really didn't understand why you were going over it so much, about the commitment to it. Of course I'm committed. I'm taking the class. Why would I even be here if I wasn't committed? She said, I just didn't get why you were trying to sell me on breastfeeding, which is something that I really try to do. It's because I know how hard it is. And I know that for those first few weeks, and even sometimes the first month or two, how hard it is and how easy it is to just say, why am I even doing this? If you don't have the reasons why you want to do this, and for any moms out there, you can all attest to this, I'm sure, then it's easy to give up. And she said, I'm so glad. I was kind of like, I didn't know why you were doing this, but after it was all over, I was so glad you did, because that's what kept me going. I couldn't get your voice out of my head and it kept me going at those moments when it was hard and it was challenging. I kept going, and yes, everything got better, and I did exclusively breastfeed my child, and now I'm on my third baby, and I still remember those words, and I do it every single time. And so please, 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 if this is your first, your second, your third, your fourth, think about taking that class. Or when you join our membership, all the classes are going to be included for free. That's going to be a huge thing. So you're going to get everything I have, okay? In the membership, you're going to get everything I have and everything I'm filming, which is so much more. We're going to be doing so much more over the next year. So that's probably, Rebecca, if I had one thing to offer you that you need to pack in your bag, is your knowledge and your commitment and your confidence. And everything else is going to fall into place. So there you go. Would you agree with that?
Absolutely. I think that preparation is the most important thing.
Yeah.
Not necessarily the things, but preparing yourself mentally and emotionally and having the support that you need.
Totally. So look, we were gonna do a shortened version today, but look how quick the hour went by. We could probably go, and I could go on for another 3 hours probably. But I just want to, again, if you want to win the Back Buddy, the amazing Back Buddy, one of my favorite, most recommended products for you for support, and just need to like this post today, comment here, tell me what you love about it, and make sure that you register. You'll also be getting updates from me on future episodes. I'm going to be live with Jamie on Monday night at 9 p.m. for more breastfeeding Q&A and fun and antics as usual. That will be over on the Baby Guy NYC Facebook page. And then Tuesday night, we have another live stream with Rebecca Mickey. She's a sleep expert, childhood sleep consultant. And we'll be doing a live stream with Love to Dream and Rebecca on safe sleep. So it's going to be a fantastic week coming up. Thank you so much, Laura, for joining me again. It's always the best.
We always have fun.
We always have fun. We'll just keep doing this. What did you say?
I said, thanks for having me.
Oh, my pleasure. My pleasure. Hearts for Laura. I see hearts going across the screen. Let's get some hearts for Laura. Thank Laura for being with us. Thank her for creating an amazing product, and then also giving one of them away today as a prize. And then there's also a discount code for 20% off of a Back Buddy, which we will post here too. And that way, if you'd like to purchase one, you can use the code to get a discount. Okay. So to everybody at home, thank you for joining us. Thank you, Conchita. Thank you, Anne. Thank you, everyone. And I hope you have a wonderful, wonderful weekend. Enjoy your families, enjoy your babies. And we'll see you again on Monday. Okay. Bye, everyone. Mwah. Have a good day.